You're welcome back. We're treating stroke before and after. This is your chance to call in and ask any questions you have. The number to call is 0808 054 2233. Again, that's 0808 054 2233. And we're going to get something out of Dr. Esho now. Now, your patient has been treated at the hospital, and he's coming back home, she's coming back home, possibly not as strong, not as fit as before the stroke happened. Is there something you do to make the person fit better into the home?
I think the first approach is the goal. What is the goal? And I think independence is the goal. You want this the patient to come back and function as an individual independently, go to the restroom by himself or herself, dress, eat, all these daily functions that we all take for granted. So the physical therapist is pretty much thinking of three things: the individual, what does that individual want? Then the task, what does the individual like to do or must do? And then the environment, does this individual like to go to church or go visiting friends? And so that forms the basis of getting back the restoration of function. And to start with, you go through evaluation. You want to see what capacity, what can they do? And if they cannot, then you're looking at reteaching, they're relearning things, and you're engaging them. And, as we said earlier in our earlier discussion, my mother's goal may not be my goal. Mom may not actually want to go back to parties. Mom might just want to go out to see my grandchildren. So we factor that in.
So let's hold it there just a minute.
Okay.
We'll come back to that. We're getting a call. Hello.
Hello.
You're on.
Can you hear me?
Yes, we can. Ask your question.
Okay, please. I would like to ask, at what age can we say that there? Hello.
We can hear.
Okay. I want to ask, at what age can we say, or can I say, the risk of having stroke is more likely?
Okay. Age factor. When is it more likely to have a stroke?
Well, we have seen strokes happening in people as young as 18 and even less than 18.
But that's not
well, the traditional belief has always been the older you get, the higher the risk for a stroke. But it is very important that after the age of 40, that you continue to monitor your medical status on an annual basis. That's one of the best ways to get in over this. You need to check your blood pressure regularly. When you go for your medical checkup, you need to ask your physician to conduct a cholesterol test, because high blood pressure and the presence of an excess amount of the LDL, the lower density lipoprotein, have been shown to be the most important factors leading to a stroke.
But can we say that strokes are happening earlier than they used to?
Strokes are happening earlier than they used to because of what I would say nonchalance for reducing the known risk factors, which is people are not getting involved in enough exercises. A lot of people are indulging in very fatty food that increases the cholesterol level. A lot of people are not monitoring their medical status on a regular basis enough to detect an impending stroke.
Okay. Let's continue integrating our patient into the home.
Into the home and into the workplace, because I think most people will be concerned, can I get back to work? And we now have tools. We have objective tools in which we can actually evaluate individuals, whether they've had stroke or heart attack or whatever the debility. We can actually evaluate objectively and look at the tasks that they actually were doing at work before. We look at the work-related tasks, and then we put them through tests, a battery of tests. And you'll be surprised that some people that suffered stroke actually can get back to work and to the same duties.
To the same job. Depending
on what the job is. For example, a sedentary based job, it's likely that they probably can get back in, to the workplace. So we'll look at what are the tasks that they do at work. If it's computer related, then we're going to test the dexterity, the hand dexterity. of that client. So it's job specific and it's individual specific.
But do we have the tools here?
Absolutely. Yeah. Some companies are doing that. They're doing that already. If you get injured, then they're going to, before you return to work, they're going to put you through the battery of tests that are research-based and decide whether you can get back to that job. Yes, some multinationals are doing that already.
Okay, another call. Hello? Hello? We don't seem to have that.
Hello? Hello?
We can hear you. We can hear you, James. Go on.
Yes. But that name on the screen is Eugene. Eugene is the name anyway.
Okay.
Yeah. I'm calling from Benue. In fact, I am happy about this program. I want to ask the doctor, the facial stroke, can it be treated totally? And if it treated, can it be treated for life and you don't have any other stroke again for some time? Because I had this facial stroke and I was treated and like it has gone. That time I feel some impact. Just the way you said, I was eating fatty foods. Then I was beginning to feel that weakness in me. But my face has come back, but not full. So what are the measures and what are the ways? How do I get my face back the way it was?
Okay, thank you.
And which type of diet are we advised to eat?
All right.
So that we cannot have a second occurrence of this stroke. Thank you very much.
Thank you very much.
My name from Benue.
Two things there. He's concerned about his face. He wants the face to come back to what it was before. Is that possible? And the second thing is the diet. What kind of things should you be eating?
Well, there have been very good results of the face coming back to normal. James should visit his physiotherapist, who will work on the facial muscles and help him, give him some exercises that he will do to get that back. With respect to diet, one of the things you really want to cut down are animal-related fat, meat, torso, they call it, and all those. You want to eat more vegetables, fruits, and if you must eat things like meat, it would be better to do more seafood, fish. They have fat, but they're low in cholesterol.
How about white meat, chicken?
White meat, chicken is also good. If you must do that, it is good. But you want to avoid all the fatty part of the meat. Well, the skin of the chicken you want to avoid. Fortunately, I would say in this part of the world, that's the very sweet part and the delicious part. But that is where most of the fat resides, and that's a good indicator of your cholesterol level.
Okay, but can we eliminate the slur, though?
The slur can be, for some people, it has improved considerably. Usually, this is the work of a speech-language pathologist. There are speech therapists who have expertise in working on the speech system, and there have been good results. It just depends on how bad the stroke is. Even with the facial droop, if it's a very bad stroke, there can be some recovery. The chances of a full recovery are slim. It is not impossible, but they are slim. But if it is a mild stroke or a stroke that was handled and treated well immediately after the stroke happened, the prognosis are good.
Okay, Dr. Esho, I'm interested in knowing what is the role of family members, because this person is coming back into the house. There's got to be a different understanding. You know, he's not as agile as he used to be, so the family can't treat him the way they used to, expect him to do things the way he used to. How do you get them to cooperate with this person?
Well, we encourage them to come in with the patient or client, and that's always so key, because I think it's the family members that really need to understand that it's a life-altering condition and it really just doesn't go anywhere. It's just the main thing. So we bring them in the care. They join and participate in the activities, and then we always give home-based activities, and that's the sustainability really of rehabilitation. It really is about what you do at home, not the 1 hour you spend with a therapist, you know. So yeah, a lot of information and education is required, and they're really with us throughout the episode of care.
Okay, Errol Brown is asking via Twitter that is it true that those who have suffered, who have a high blood pressure shouldn't eat eggs?
Well, it is not true, but it is advisable that those who have had high blood pressure avoid foods that are high and rich in salt. Or they should go on a low sodium diet. If they must eat eggs, they should eat the white part of the egg and avoid the yolk. The yolk is very rich in cholesterol. And remember, high blood pressure plus cholesterol is a good precursors for a stroke.
Okay. Before we leave, because we're about to leave, I want to ask Dr. Esho to tell us anything we really need to know that we haven't covered yet.
I think ownership of any dysfunction is important. I think the individual is really, with stroke you find that depression is the main feature, and family members can help with that. I think we should stop relying on the traditional, you know, solutions and listen to what the experts do actually have to say, you know, and my takeaway is ownership. You must want to get back yourself, and I think it's possible.
Okay,
Yeah.
Just before we go, I really have to get this in because you mentioned somebody's goal might not be so high up.
Yes.
What do I, as a daughter or somebody as a son, what do we do when all Mama wants to do is just live?
Yes. Let Mama define. We will help Mama define, Mama, what do you want to do? And if Mama says, well, all I want to do is sit down here, we'll say, okay, all right, we'll sit down here and we can show you how you can sit down better. But let's go to the restroom. You'd like to do that by yourself. And once Mama finds she can do that herself without possibly the cane or with the cane, then Mama will be motivated to go to the living room and see her visitors. Yeah.
Thank you so much for coming. We've got
You're
to go.
welcome.
Thank you, Professor Akinwuton. Thank you, Dr. Esho.
You're welcome.
This has been very enlightening. And thank you very much for staying with us. Ownership and 2, prevention. Live a good life. I'm Mary Alale Yusuf. Bye-bye.